Today we will be discussing about ventilator-associated pneumonia. Now, nosocomial pneumonia, or that is a pneumonia that is acquired in hospital, can be divided into two. The first is hospital-acquired pneumonia, is a pneumonia that is acquired more than or equal to 48 hours after hospital admission. So, you develop a pneumonia 2 days or after, more than or equal to 48 hours after hospital admission. On the other hand, VAP refers to a pneumonia which is acquired in intubated patients after 48 hours of mechanical intubation. Okay, after 48 hours of endotracheal intubation and mechanical ventilation. So, almost their clinical features and the organism which is causing these clinical syndromes are same. So, I will be discussing mostly about VAP, but most of which are applicable for hospital acquired pneumonia also. Now, we should understand the organisms which are causing ventilator associated pneumonia can be non-MDR organisms, or it can be an MDR organism also. That is, MDR means multi-drug-resistant organisms. So, the organisms can vary depending upon the duration of the hospital stay of these patients. So, non-MDR organisms are like Streptococcus pneumoniae, Haemophilus influenza, as well as MSSA, and antibiotic sensitive gram-negative bacteria can occasionally cause VAP. Most often it is usually MDR organisms. Occasionally these organisms can cause VAP, especially in patients within 5 to 7 days of hospital admission. VAP developed within 5 to 7 days of hospital admission. There is a possibility that non-multidrug resistant organisms can also cause ventilator associated pneumonia, but most often it is multidrug resistant organisms like Pseudomonas, MRSA, drug resistant, antibiotic resistant gram negative bacteria, especially Enterobacteriaceae. So, Enterobacteriaceae includes Klebsiella, E. coli, etc. Okay. So, Enterobacteriaceae, multi-drug resistant Enterobacteriaceae. Okay. Acinetobacter is another important cause. Acinetobacter baumannii. So, Acinetobacter, MDR, Enterobacteriaceae, MRSA, Pseudomonas. So, these are all causes of ventilator associated pneumonia. The microbiology differs from hospital to hospital. For example, in our hospital, most often the organism which is isolated is Klebsiella pneumonia, which is carbapenem resistant. Your hospital can have a different microbiology or different microbial prevalence. Like the other hospital where previously where I worked, the Acinetobacter was the most common organisms. It is very important that you understand, okay, you understand the local antibiogram or the local prevalence of each organisms causing ventilator associated pneumonia. Only then you will be able to empirically treat ventilator associated pneumonia. Now, can you predict whether the patient, a particular patient, is having an MDR VAP or not? So, there are certain risk factors in general for MDR organisms, MDR VAP, that is VAP caused by MDR organisms. So, if the patient has a prior IV antibiotic use in the last 90 days, within 90 days, if there is septic shock at presentation of VAP, if there is acute respiratory distress syndrome preceding VAP, more than 5 days of hospitalization, there is acute renal replacement, that is dialysis, acute renal replacement therapy prior to VAP onset. So, any of these factors, if it is there is a risk that the patient is having a VAP due to a MDR organism. That is, intravenous drug antibiotic use is the most important risk factor for MDR VAP. Now, most of our patients who develop VAP would have received antibiotics, and that is a reason why I say that most of the VAP in our country is multi-drug resistant. It's due to multi-drug resistant organisms, and it has to be treated as multi-drug resistant organism causing VAP.